All right, guys, welcome back to Underground Science. And in this video, we're going to be talking about carbon tetrachloride toxicity. Okay, so what's the main thing that we should know, or the main cause of this is anything relating to the dry cleaning industry. All right, so dry cleaning industry. So that's the main cause that we should be familiar with. And so let's start talking about carbon tetrachloride, right? So carbon tetrachloride will actually go to your liver and get converted into trichloromethyl radical. So that's CCl3 radical, right? It's a free radical. We know free radicals are damaging to our proteins, damaging to our DNA, and is damaging to the cell membrane. Okay, but first, how is this trichloromethyl radical even formed in our liver? It's formed by our cytochrome P450 enzymes, right? So our cytochrome P450 enzymes take the carbon tetrachloride and convert it into a toxic free radical, also known as trichloromethyl radical. Okay, and this is bad because obviously this is going to injure your hepatocytes, which can lead to hepatocyte swelling, right? Because of cell injury. So hepatocyte swelling, obviously, because it's a free radical, right? It's going to damage the parenchyma overall. So this can actually lead to necrosis of your liver parenchyma. Okay. And then another important thing that we should know is the trichloromethyl radical can actually disrupt. It can basically disrupt certain organelles, but the main organelle we should know is it can disrupt the rough endoplasmic reticulum. And why is this bad? Because remember, the rough endoplasmic reticulum has ribosomes on it, and ribosomes are important for protein synthesis. So in this case, if you disrupt the rough endoplasmic re- reticulum, right? Couldn't speak there for a moment. If you disrupt the rough endoplasmic reticulum, then that will lead to, then you won't be able to synthesize apolipoproteins. Because remember, in lipid metabolism, your hepatocytes, right? They synthesize apolipoproteins, which are responsible for basically packaging fat and sending it out of the liver, right? So apolipoproteins will not be able to synthesize, will not be able to be synthesized if your rough endoplasmic reticulum is disrupted due to the cychloromethyl radical. Okay. If you can't do that, again, remember apolipoproteins are important for doing what? Taking fat inside your liver, and it's supposed to take the fat, package it, and send it out, right? Apolipoproteins are important for that. Okay, like VLDL, for example, right? When your liver makes VLDL, you need apolipoproteins in order to help package that fat and send it out. But if you can't do that, the fat stays inside your liver. And then so what you see with that is steatosis, or fatty change in the liver. Okay, so this will lead to steatosis, or fatty change. Make that as one finding, right? Fatty change in the liver. We also said that free radicals are overall damaging to the liver parenchyma itself, which can lead to necrosis. So another change would be seeing necrosis of the liver parenchyma. Okay, so we have necrosis and fatty change of the liver. And then, of course, if your liver is necrosed and getting injured, then we're going to have, and if your membranes are getting damaged, right? Because that's what it means, because necrosis is not reversible. So you're going to have membrane damage. If you have membrane damage, you're going to have enzymes that leak out. And so we're going to have an elevated AST level and elevated ALT levels, indicating liver damage, right? And of course, if your liver is damaged, then we know a common sign of liver damage is jaundice. Okay, so then this will lead to jaundice. Okay, and why do you get jaundice and liver damage? Because remember, your liver is responsible for taking the unconjugated bilirubin and conjugating it, and then putting that conjugated bilirubin into your bile. Okay, but if your liver is damaged, you're not able to metabolize bilirubin, So you get a buildup of bilirubin in your blood, leading to jaundice, which is a yellow discoloration of your skin. And also, you can also see that in your conjunctiva of your eyes or your nail beds, for example. Okay, so you're going to see jaundice due to liver damage, and due to liver damage, you're going to see elevated liver enzymes like AST and ALT. Okay, now, of course, if this becomes severe, right, and if you have severe level liver failure, something to keep in mind is remember your liver is important again for um, obviously getting rid of uh, bilirubin, right? So you don't have a buildup of bilirubin in your blood. But if you can't do that, then bilirubin will build up in your blood, causing jaundice, like we talked about. And also remember, the urea cycle occurs in your liver, okay, where you convert ammonia to urea. If you can't do that, you're also going to have a buildup of ammonia, right, and severe liver failure. And then this both can lead to encephalopathy. Okay, so that's an important thing to keep in mind because of the liver failure. And then also remember that because you have liver failure, remember your liver makes certain coagulation factors like factor 2, 7, 9, 10, and then protein C and protein S. So obviously, if you're not making coagulation factors, this can lead to, or you're not making coagulation factors due to obviously your liver's failing, then that can obviously lead to a coagulopathy. Okay, so it's important to keep that in mind also. And do know that this carbon tetrachloride toxicity that we're talking about can also lead to renal failure too. So it can affect your kidneys also, not just your liver. Okay. And that's basically it. Those are the main findings that I wanted to discuss. Of course, you would want to know the main things, which is the damage of the hepatocytes and the disruption of the rough endoplasmic reticulum, leading to steatosis or fatty change in the liver. Of course, free radicals damage your parenchyma of your liver, so that will lead to jaundice and elevated liver enzymes. And then, of course, keep in mind that if your liver is failed or if your liver is getting damaged significantly, you're going to have coagulopathies because your liver is responsible for making coagulation factors like 2, 7, 9, and 10. So you may see bleeding, right? Increased frequency of bleeding. And then also remember that your liver is important in terms of metabolizing bilirubin and in terms of the urea cycle and decreasing ammonia levels by converting ammonia to urea so you can pee out the urea if your kidneys are functioning properly. Okay, so if you can't do the urea cycle properly, and if you have a buildup of bilirubin due to liver failure, this can lead to encephalopathy. And of course, also keep in mind that this carbon tetrachloride toxicity not only affects the liver, but in severe cases can affect the kidneys too. Okay, so it can also cause nephrotoxicity. All right, so those are the main findings that I think it's important to remember. I hope this video helped a little bit, and I hope to see you guys in my future videos. Thanks for watching.